Hello everyone, welcome to another episode of Picment Show with the Professionals. And today with us, Miss Madhu. Miss Madhu, welcome to the show.
Thank you for giving me this opportunity to be on the show. Thank you, sir.
All right, so here I am giving opportunity to the guest to introduce self.
Hello, everyone. My name is Madhu and I am basically from Patna, Bihar. Presently, I am working as a registered nurse in a government sector under Ministry of Health and Family Welfare. I have done my graduation in nursing from Rajkumari Ambedkar College of Nursing, New Delhi.
Okay, for the viewers, the basic motive of this show is to share the experience and knowledge, what we gain as professionals, like that. And as Miss Madhu is considered, so she is specialized in pediatric ICU, intensive care unit. Okay, so how is your job in pediatric intensive care unit?
Yes, sir. From last 2 years, I am working in Paediatric ICU, caring the patients in pediatric department. And also, I have worked in, after attaining my graduation, I have worked in private hospital also. So I have, there also I have worked in ICU. But that was an adult ICU, so experience over there was very good.
So I have a question over there.
Yes,
yes. So when you have worked the adult ICU,
yes,
adult intensive care unit, and now you are in pediatric ICU, yes, working as a nurse in pediatric ICU. So what is the basic difference over there? So both are ICUs?
A lot, sir. Caring a adult patient and caring a small babies, pediatric patient is totally different. Earlier, I also thought that it won't make much difference, like switching from adult ICU to a pediatric ICU won't be much difference because procedures will be same and same drugs and same calculation will be there. But after
but same calculation with a lower dose, I think, right?
Yes, sir. But according to the body weight of the patient.
Yeah, body weight, all right.
Yes.
So there is not much difference.
It is, because in adult, if we have to give an injection, it is a very calculated dose. Okay, we have to give 1 gram. But here in pediatric, it is according to the weight of the patient. So a pediatric patient can also be of 3 kg, 4 kg, 10 kg, 15 kg. So it depends for every.
So the medicine calculation part is very difficult.
Yes,
right.
For making infusions, for making IV fluids, for everything, you have to be very exact. For an adult patient, if it is 1 gram and you get doses of 1 gram, and by mistake if you have given 1.2 gram also, it is like small error. But in pediatric, you cannot have that thing.
Okay, but anyway, the medication and all these things, it will. So for adult patient, the medication is coming in a measured dose,
yes,
like that.
Yes, it is the standard dose.
So yeah, the standard dose it will come. So there is not much chances of error in case of adult patient, right?
But in pediatric, you have to calculate. You have to recalculate the dose. Then you have to see how much is the balance, and these drugs are so costly, sir. Right. So you have to see how much is the cost of the drug. Right. If it is like 1 gram drug is costing you 5,000 rupees and child has been prescribed 250 mg, so it is so costly for the patient party side. So you have to ask for a lower.
So it can be reused, that in the sense you tell.
It can be, but what if the patient is having that dose OD? You can't store a dose for a longer time.
Okay, so
like
at one
storing
time only
a drug.
Giving.
Yes.
Right. Okay.
That has to be stored for a limited period of time. Like for 24 hours, you can refrigerate a drug. For 48 hours, you can refrigerate a drug. But if a drug prescribed dose is so small that it can be used 10 times or 15 times, so that is totally wastage to the patient party. It is the financial loss patient party can have.
So is there any solution on your part, like on your experience?
So then we look for alternative, that whether a drug is available in 1 gram. So whether in any other pharmacy or outside the drug is available in lower doses, like 250 mg. Okay. Like there are many drugs. If I can name, it is ceftriaxone. It comes in 1 gram also, 500 mg also, 250 mg also.
Okay.
So when we are intending it for the patients, we see okay, the patient is of 2 years, so patient will have lower dose. So you intend 250 mg.
All right. So in general, how is your job responsibility like when you go to the duty and taking handover from that time itself your duty? So in general, what are the responsibilities?
It is so hectic. Like from taking handover only, you can.
Is it hectic or is it chance to learn and skill
yes
new things?
Yes, sir,
like
right. It is like every day you will experience something else. You will get
So
chance.
you mean to say like every day is not the same in
Yes,
the
every
ICU
day is not
department,
the same.
especially on pediatric
Yes, yes.
ICU, right?
For each and every patient, you will have different experience.
Okay, so could you make an example of like?
Yes, sir. Like presently, if you have three pediatric patient, bed number 1, 2, and 3, all are of the same age group. One is of 3 months, one is of 4 months, one is of 6 months.
6 months.
Almost
Yeah.
same. So everyone will have different demands. One will be on breastfeed, maybe on breastfeed.
Okay.
One may be either on demand feed. One may be NPO, nothing per hour. So it is like patient demands are changing, though all the three patients are of same age group, maybe
Almost the same age group, but their demands will
be different,
especially on the nutrition side. And
nutrition side also, sir. Then there
okay, so some patient in NPO, so they could give, they need to give infusion, they need to
Yes,
start with the
IV
infusion,
fluid,
but
glucose.
it is not needed for the other babies like
no,
that, right?
because when patient is tolerating orally, so there is no need to give an IV infusion of anything.
All right.
So when patient is taking orally, it is all right. But when patient is NPO, not getting anything by mouth, so that time you have to give IV. So for that patient, now everything, whole scenario will change over here. You need to have an IV access, and patients like small.
And getting an IV access to this much small kid, how
so
it is like?
hectic, sir. Like you need 2-3 people to hold the baby, because patient will.
For this small baby, 2 to 3 people to hold.
Patient, if a child is of 6 months, he will try so hard to get rid of everything. He will hold the hand, and you have to be delicate also with babies. You can't be harsh and hold the baby,
so if
grab the
one
baby.
person is holding, then it couldn't be, it could be harsh, right?
Yes, sir.
Yeah.
One
So if
has
it
to
is 2 to
pacify the
3
baby also.
Yeah.
One at the same time, one has to pacify the baby also. It is like you have to keep pacifying it, keep diverting his mind, so that he don't think, okay, you are going to harm him, you are going to prick him, he's going to be.
Otherwise, if the baby is crying, we could get diverted from our procedure,
Yes,
right?
we will not be able to see the, if you are getting an IV line, a patient is like very too much violent and like going here and there, and you can't be able to do it fastly. So it is that much difficult over there. Then you will need helping hands, one to pacify the baby, one to hold the baby well, and it is, as I have already said, you can't be harsh. You don't have to be so tough and hold the baby tightly.
So there is some method, like I have heard, like this mummy method and all these things.
That is for newborns, yes.
Newborns,
But to mummify the baby. It is to wrap the baby. So
but I have seen for much bigger kids also, they are trying to hold like, but it's actually it is not the right way, right?
In
some hospitals I have seen, like they have made it's mummifying the baby, like holding the hands like this and just covering.
It is possible, sir. It is possible, but when you have a lot of infusions to connect, lot of IV fluids to go on, then that time, and in ICU we have so many props, SpO2 prop, then ECG prop. So everywhere the child will have some attachments.
Okay.
So in that situation, it is a bit difficult to mummify the baby and completely wrap it. And then we also have to look for the sites also, if the patient is having a cannula or some IV access, and if you mummify the baby, okay, for 5 to 5 hours, 2 hours, 1 hour, and you don't observe the site, then it is, if the site is not proper, so that is a problem. So we have to be good observer also at the same time. Whether the patient
so coming to your job responsibilities, like you have told, like, so mainly with taking admission of the babies, okay, and acting differently to different patients, like that. And what else?
In our ICU, sir, you will every day experience something different. Like if today I have get a new admission, maybe that patient is ambulatory, speaking, crying, and is okay. Maybe the next hour, if you are getting an admission, maybe that patient is on ventilator. So carrying a patient on ventilator is a totally different scenario compared to a conscious patient. So
for our international viewers and all the nurses working in ICU, so could you make the difference how how skillful it should be to take care of the ventilator patient, especially the pediatric one?
Yes, sir. For like if you are caring for an adult patient who is on ventilator, you can still expect that the patient will make some gestures and try to tell you something if he is not sedated. he'll try to convey his
So most
message.
of the time the ventilator patient would be sedated, right?
Most of the time, but when we have to wean off,
Yeah.
that time patient will have to be off sedation. Weaning time, that time patient has to be off sedation. But in pediatric patient, you have to keep the patient sedated because child will not cooperate.
Corporate and the child won't able to understand because its age is like that.
Yes, because he won't be able to make you understand what he want to say, what problem he is having. He's
The
having
only thing
abdomen
that he
distension.
knows is to make his reluctance like that,
Yes.
to express like crying and all these
Or
things. Right?
you will have only one experienced child is very not cooperating, violent, so you have to sedate
Okay.
the patient, and then under sedation you have to be
And
a
also I
very
have one more
keen
question,
observer.
like too much sedating means how extent we could sedate babies like that?
So there is calculation for that
Okay.
according to the dose,
So
according to the body weight.
my question is like how long we could keep the baby in sedation? Like so is the answer is till the time the baby is in ventilator or?
No sir, when we are trying to wean off the patient, that time we have to gradually taper off sedation.
Okay.
For like every day we have to give sedation holiday
my
to the
question
patient.
is like the baby demands to be kept in ventilator for 2 days or 3 days like that.
So that depends upon the prognosis and disease condition of the patient.
Yeah, no. If there is a situation like
Yes.
the baby is needed to be on ventilator for 2
Then
days.
one day prior to the, if today we have planned for extubation of the patient, then one day prior to that we will try to taper it off.
Taper it
and
off. The sedation, right.
Yes, and we'll try to keep the sedation off. Otherwise also, when the patient is on ventilator also, we need to give them sedation holidays. Like if the patient is having sedation for 24 hours, we'll try to have sedation for 2 hours and then off sedation for 2 hours.
Okay.
So we will try to give sedation holidays so that we can see how much tolerate patient can do.
Okay, so it could be done with less amount of medication. So the sedation could be done with less amount of medication.
Yes,
it would be
yes.
much better for the baby,
Yes,
right?
yes.
Okay,
Very
because most of the medications would be on side effects and
Yes,
having
they have hepatotoxic.
effects,
Yes, patients have
because
them.
it would be,
And also
because
that
the baby's kidneys, liver may not be that much
Matured.
matured
Matured
to be,
enough.
to handle with all
and
these
also that
medication.
will have further problem.
So
for
just like the same like adult patient, so whether the LFT, liver function test and kidney function test will be done prior to
Yes.
the kids as well, right?
Yes, sir.
Okay.
Routinely, it is like when the patient, we get the admission, that time we do all the blood profiles so that we have the baseline values of the patient. And gradually, then alternate days, we do the blood test investigations and then we see whether it is decreasing or increasing or we have any alteration in the values.
And there is another thing to consider while taking care of the baby. I have heard like
Yes.
at one prick, if you could take the blood for the whole test, it would be better rather than pricking. So I
Multiple
think it would be
times.
done at the time when if there is a cannula need to be placed, it would be taken at the time
Yes.
when you place the cannula itself.
That
right?
is a much
Better
option. But things changes in practical situation. Like if I did a blood sampling today for the patient in the morning shift, but by the evening shift you still want to have another blood values
Okay.
just to see whether the condition has deteriorated or not deteriorated or electrolytes have changed or not. Then you need to have like blood gas. We in ICU we
Yeah,
do
arterial blood gas,
yes,
ABG, right?
Yes, we do it.
So
BD.
I think it would be much painful for the babies as well.
Yes,
too. Yeah.
pricking an artery is very painful.
Very painful for the baby as well.
But still, we have to do that because we need
So
to
maybe
get
the fine needle will be used in that case,
Yes,
right?
we use 2 ml syringe and mostly 1 ml syringes are mostly preferable. But sometimes we are not exactly because pulses are for many patients. Pulses are very feeble. So by 1 ml syringe, we are not getting to get the exact.
So we won't get that much depth,
Yes.
right? Okay.
So we use 2 ml syringes for that.
Oh.
So scenario changes as when you are caring for an adult patient to a pediatric, scenario changes a lot. In adult, I thought as I have worked, I feel in working in adult ICU is much easier as compared to working in a pediatric ICU.
Okay. But the real part is you are doing much more. Like in while taking care of adult patients, you will
Yes.
get less satisfaction than you are taking care of the kids, I think, right? Because you are helping them, because the kids are the future adults, and
Yes, sir.
yeah. on that
You will
sense.
also enjoy also, like when you are going for a shift in an adult ICU, you will just complete your shift. Okay, I have done. But when you see a child, automatically a smile will come on your
And
face.
especially with the prognosis of the kid, means patients
Yes.
who are children, right?
Yes, sir. Because we have seen patients who have terminally ill patients. We are seeing
Okay.
with oncological disorders also,
Okay.
and those child are so motivated for their life. Like their parents are so motivated. They try to like okay, they don't feel dismotivated. They are like okay, our child will get cured.
Yeah, okay. So they have that
So that time
positivity
you will
still.
also feel boosted. Okay, no, I have to do this. I have to care for this patient. I have to make
And
them
anyway,
feel.
the medical science is that much advanced. Like there could be some good prognosis on the oncology patients as well,
Oncology
right?
sites,
Yeah.
yes.
Because I think the recovery of patients who have oncologic disorders, it would be much higher than in I think adults. Okay, no, in children than in adults, I think, because the children are on their development stages. So
But it affects badly, sir, because bone marrow is affected. When we have BLL patients, leukemia patients, so they need rapid transfusion, so many transfusions,
Transfusions.
and their bone marrow is already in the developmental stage. So if the bone marrow is damaged or like the body is not making cells adequate for the body, so that time it is like the only cure is that you keep on transfusing, and if the disease has a prognosis, and then only it can be some helpful to the patient.
patient, okay. No, I thought like, the prognosis of adult patient is much lesser than comparatively to the pediatric children like that, because the prognosis could be much, because the children are on their development stages. Okay, so some of
both
the,
sides.
so it depends, I think,
Depends.
right?
It depends.
It depends upon the stage, on which
Stage
stage.
also, yes.
Yeah.
It depends upon the stage. Mostly, like we have seen patient when patient comes to the hospital, they are mostly on their like last almost the stage like that. Okay, patient party. They don't recognize that
Okay.
patient is on.
So it would be very
having-
difficult, like they may be on their terminal stages, like
On their
okay,
terminal
stages, and the patient party is not recognizing, like okay, so we need to make it palliative, like that. Only
Yes.
palliative therapy is
Yes,
left for
yes, sir.
such conditions, and it could be, they will be on a period of like denial, anchor, and all these stages.
Yes, sir.
It would
A
be
lot,
like,
a
they
lot.
couldn't accept, actually, like nobody
Yes.
could accept like that such situations, but to dealing with such type of a patient attendant, it would be much more difficult in
Yes.
pediatric
The
cases.
worst part is that we have to make the relative understand the disease prognosis and the course of the disease, which making an medical thing understandable to a layman is so difficult, sir.
So difficult.
So because they are emotionally attached to the patient. So for them,
Yeah,
the
for
child
children,
is the
obviously.
whole world. So they will think only the positive thing. If you say okay, the patient is on ventilator and his condition from as compared to yesterday is like this and has improved, they will think okay, now the patient is improving, but
Okay.
they will ignore
And also
that.
the convincing part when it comes on admission time, it is also difficult, I think.
Yes.
This is a much higher thing, like scenario, like, the patient is on terminal illness, and we need to make the patient party understand, like, the patient is on terminal illness. There is only
At
this
last
thing left.
moment also they will have some hope that maybe their child will revive and their child will survive. So
Okay.
at last moment also they will come to you and they'll ask, my baby is fine or not, he will improve or not. So it is like what to say, it is totally on
Okay,
last
so it should
stage.
be explained too many times also. Then also we
Yes.
need to console them, and
Yes,
we need to
yes.
explain, like, no, it is because we are supposed to tell the truth. We shouldn't give a false hope
False hope.
to the patient as well, means patient attendant as well,
Yes.
on this condition, especially it's the child is concerned.
Yes.
So if we are giving a false hope and something is happened, then it would be a very difficult thing,
Yes.
like that. So at the time of admission also, I think it would be very difficult to separate the child from the parents, like that.
Yes, sir. Child, like they have this stranger behavior. Child will have stranger behavior because once the patient comes
That
in
means
ICU.
stranger anxiety, you mean?
Yes, sir.
Stranger anxiety.
Yes, sir. Stranger anxiety. At the time of the admission, when patient comes to the ICU, that time only we separate the child from the relatives because we don't allow relatives in the ICU. So that time, the baby is like, okay, I am away from my parents.
This is because maybe the chance of infection,
Cross
right?
infection,
But
yes.
cross infection, but they won't understand like that.
Yes.
That may be the problem.
What patient you are talking about? Patient, even relatives don't understand, sir.
No. I am telling about the patient relative,
Yes.
because patient is a kid. Actually, it is not the age for them to understand like
Yes,
this.
sir. So at the time of admission only, as soon as the patient is inside the ICU, we separate them. That relative is not allowed in ICU. There is one fixed time period.
So normally, how many relatives would be? It would be there.
Sir.
So sometimes I have seen the whole village is
Yes,
with the
10,
patient.
15.
Actually,
as
with
many-
adult, but I don't know whether it's the same with the
Same
children.
scenario, sir. 10, 15, as many you can ask, they will be there outside, waiting
Okay.
outside the ICU. And
Alright.
every time one person will come. If they in the
And we will explain everything.
yes, in the visiting time, it is like the whole queue is waiting outside. One person will come, they will see the baby, then one will go, then another will come
Okay.
again, and then every relative will keep on coming and keep you asking the same question: How is the child? Is improving or not? What is the condition today? Why the sampling is being taken on?
So if the patient relative is like A, B, and C, when A comes to see the patient, then you need to explain like to A, then B, then C. The whole history is everything.
Everyone, minimum
everyone.
5 to 6 relatives will be there with the one patient.
So whether you couldn't tell like we have explained everything to A if B is asking.
So still that's the same situation. They will say, okay, you have explained this to his father.
What
or
if you
his
have
mother.
told like if I am answering your questions this much, I won't get that much time to take care of your baby.
But still they will have, if I have admitted my child, I need to get my answers answered.
Okay, so
They are
then
like,
there would be for the immediate parents of the child, like it would be father
Mother and
mother.
father.
So you need to just explain to them, and you could tell like I have explained the baby's father and mother. Right?
Sir, many of the parents will not understand, first of all. So they will call some elder person from the family member.
So actually, younger person are more understandable, right? More literate, and they
So,
could understand more, right?
Presently, where I'm working, there it is like people get married in the younger age. So if we explain something to mother and father, and obviously we explain, the doctors explain to the immediate relatives only, that is mother and father. So mother and father will convey it to other relatives, but still other relatives will come and they will again ask the same situation, and they will say, we are the grandfather, we are the grandmother, and we are the elder person, we need to know everything because they are the kids, they don't know. So it is like, okay, for to how many relatives we will keep on explaining each and everything. And every day, this is the same situation every day. They are not satisfied by.
So then there is another thing that you could make, like on my opinion, like, so in your family, who is the most understandable person, like that? Okay, and you need to explain that person. And whoever could understand better, they will explain
but for
everything to the
consent
family.
and all, we will call the mother and father only.
Alright.
Because the ultimate
Nobody
chance-
else, nobody else could get,
Yes. So ultimately we call mother and father. So it's like everywhere, the whole village will come, and when you will ask for a work that you have to donate blood and or anything like that, everyone will run out.
Run out.
Then
So
no
when
one
there is a
will-
need, there won't be anyone.
No one.
And when there is no need,
everyone will come,
means the whole
everyone
village
will
would be
come
like
and
there.
they will see
right?
patient.
Okay, so that's a scenario.
That's the
That's very different scenario, right?
dealing with the patient
So I think
party.
it should be different from adult patient. I think like the same with the adult patient also, but I have seen. But I thought like if it is kids are concerned, they will be more responsible from their part. Actually, I
as
thought
far
like
as kids are concerned, the relatives are more worried. More worried, and many relatives will come. Uncle will come, auntie will come, mother, father, Masi, everyone will come. Grandfather, grandmother, and everyone are equally worried for the child.
okay.
Whereas for an adult,
Worrying for a child is obvious.
Yes,
Use the
it's-
whole family. Yeah,
it's-
that's okay.
it's okay because when I consider them in their shoes, like if I consider if I am on their part, then maybe I am also
We
worried.
will do also the same
Yeah,
things.
of course.
Like, right.
But the only difference which I can make is like, okay, if I have a conversation with the doctor or the physician or the treating consultant, then I am satisfied. Okay, now this thing is going on. I will convey it to my other family members. I
That's
will
the
know.
thing. That's
Yes.
the thing that we could
If
do.
I am satisfied, if I have understood each and everything, then I have to make it understand.
So in each and every family, when the kid is going to be admitted, then there should be such person
Yes.
like that, right?
Yes.
Who could make all the family members understand. Then our job will be very
Who
easy.
can understand at
Right.
least, who can talk to the doctor and can talk to the other relatives also, can make
Right.
them understand, because we will convey it to the one family member, he will only grab 5% of it, then convey it to another one, the another person will come, he will again ask the same thing. So our half of the time will be gone like this only.
All right.
Because conveying it to one, second, third, and just imagine if you have 12 bed ICU, you have 10 to 12 patients critical in ICU. And if you spend 10 minutes, 15 minutes on each and every patient explaining them the whole scenario, your half the time is gone, sir.
Anyway, you will be now skilled enough to manage with all these things like that,
Yes,
right?
previously-
even if it is, this much, there is time limitation, all these things. Now, day by day, we keeping on the experience and
Yes,
all. You will
yes.
be smart enough to tackle with all these things like
Yes,
that.
sir.
That would be the positive thing, right?
Previously, when I started over here, I was even fearful to handle ventilator patients, and I used to think, okay, now what?
Even when you have experience with the adult ventilator and all these things.
No,
then also-
on the initial phase. On the initial phase,
alright.
like when I started my career,
Oh yeah.
that
Okay.
time I used to think, oh my God,
No,
how?
I thought when you have done with ventilator with the adults and all, and now when it is the kids are concerned, when you are handling the ventilator, again you have the fear factor.
No, not that time.
no.
During my initial phase.
Initial phase, alright.
Initial phase. That time when I was newcomer to this profession, so that time when I stepped in the ICU, I saw so much of running.
This ventilator itself is very horrifying thing. I think there are too many things attached to that, just like a very sophisticated machine, and also with so many beep sounds, and there are some other sounds
Yes.
which is noisy things and all these
Yes.
things, and have the LED effect like blinking this green light, orange light, red light,
Yes,
like that.
that is
So
the worst
it will be-
thing during night time. Like everywhere you will have beep, 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 beep. Somewhere syringe pumps are making some sound.
But after
monitor.
some time, you will experience it's like a music, like that, right? Maybe. So one of my friend who continuously worked in ICU, and I have told and he have got some like holidays from off duties like that, and he is telling I couldn't able to sleep actually. So I thought you have got holidays, you need to be relaxed, and you could enjoy your holidays and you could sleep well. But he's telling nowadays it is very difficult to sleep without listening to the ventilator sounds and all these
my
things
God.
like that. Because he's on, I think 6 years on, but he's actually working internationally. He is
Okay.
in Ireland now, working in ICU actually. Surgical ICU like that, and he's telling I couldn't able to sleep like that. So this is the case. So person to person it may be different as well.
Not like sleeping, but I do feel ki when I am not at duty, so I feel bored. Like okay,
So something is missing like
no,
that.
you have to when you are at home and leave and all. So you wake up at 8 o'clock, 9 o'clock, then just eating and then lying down and like that. So it is so monotonous. I don't feel so happy. But when I am on duty, I'm so jolly, so nice. It is okay, and duty.
And what about your working environment, about your colleagues and all? Is it?
So it's very, very very cheerful environment. That is the reason
Because
I
the
like.
team spirit, right?
Yes, that is the reason I like, because everyone is, even if it is very busy, you are running for everything, each and everything you are running and you're making sound. Okay, give me this, give me that. You are in something. You are in. Still, in between, some will crack some joke, and you will be okay. Oh. So these are very cheerful
It will
environment.
be, the colleagues are very helpful as well.
Very
right?
helpful, sir. Very helpful. Everywhere where I have worked, I have got the best colleagues. I feel because when I started my career,
In the whole world, the nurses enjoy their work just because of this factor.
yes, the team.
The team.
Team.
The team and their colleagues, the spirit.
Yes,
like
the
that.
team.
It is our colleagues.
Well, I'll include doctors also, the other team members also.
So I included all. Means
Yes.
the team means the whole
Yes,
part. The
it's
whole unit,
not only
right?
the nurses. If your doctors, your professional, your physician also
Yeah.
had to be very moody. Okay, you want to do this? Okay, sister, you do this. I'll help you. So it is like that. So the things will go on track. Otherwise, if your consultant is like a scoldy type of mood of okay, always scolding you and all, so you will also feel
No motivation
fearful.
at all to do the work like that.
Yes,
Yeah,
yes, sir.
it's all the same, right?
Yes.
Everywhere, if there is no motivation, the people won't be that much energetic.
And
So
the
same in
whole
this
credit
profession as
I'll
well.
give to my colleagues only because whatever I have learned and whatever skills I have grabbed, it's because of them. They have taught me, okay, you are new, you are fresher, you come, I'll tell you how to take ABG, how to give an IV access, how to insert an NG tube. So everything my colleagues have taught me. So it is very good experience, sir.
Still they are helping, and working as a team is, very cherishful thing, right?
Yes.
Yeah. And what else on your job responsibility, like what the difficult things that you will do daily, like that?
Sir, managing patient in like when the patient is ambulatory and conscious and very now they want to go home, managing that patient is very difficult because you have to convey him, make them understand that you have to be in ICU, have
So
to
the
keep
small kids, how you will convey and how you will make them understand like that? What you,
specifying
whether you will tell stories to them?
No,
like,
sir, they will not understand that thing because they are
no,
like,
for a much, it is not like very small kids. Like somebody is a toddler, and so anyway, it's a
for
diversion,
toddlers
right?
and all. We give them toys.
Toys.
So they
toys will divert.
So
they,
for
they are
them,
not in a mood to listen to the stories and all, because they would be very busy,
yes.
right?
So for them, we will give some toys and all, and we will talk to them. Then sometimes the babies also smile back, and they listen to us. They watch our facial expressions, like how she is making, and sometimes they will smile back. So so they will like be familiar with you. So when you go to them for an
So when the time of admission, the patient with the parents, they are coming to your place,
Yes.
and they may not be familiar with you at
Yes,
that time,
yes.
right? So how you make them familiar to you actually, like that? So all of a sudden, if you are going to the child, right, they
for
want
the time being, we ask the relatives to be with the child and pacify him, make them understand that he is in ICU and nothing is going to harm him, nothing, these probes are not going to hurt him. So accordingly, and then
so for a small duration of time, the parents will be with the child even inside the ICU, right?
yes, we allow them, but for a limited. If the child is quite uncalm, sometimes we get that chances also. So sometimes if the child is
Very
quite
understandable child, right?
yeah,
Very
like 10 years, 11 years children are
Okay,
there.
okay.
So they are
But it's
understand.
not going to happen with the very small kids, right?
No, very small kids are like, okay, oh my God, they will make everything how, who, like this.
Okay.
So sometimes, or either the child is very lethargic because of the disease condition. So he's sleeping.
All the time.
He's sleeping, he's not conscious too much, lethargic, semi-alert. So in that child, we don't need relatives to be there all the time because child is not making you so much difficult. So that time you don't need relatives to be there.
Okay, so coming over to the level of understanding of the patient relative, like the parents. Okay, so you need to give health education,
Yes, sir.
on so many aspects to the. So what are the common things that you will educate them?
Sir, hygiene.
Hygiene.
First of all, hygiene.
So you will tell like your child need to be on good hygiene to keep away from the disease.
Yes.
And you also, as you are taking care
Apart
of the
from
child.
that, when relative is coming from outside, outside the relative are just sitting with 2 or 3 or 4, 5 people, and when they are coming to the child, they are bringing infection. So that time that the relative has to understand, whenever I step in the ICU, I should wash my hands, and whenever I'm touching the patient, my child, I have to sanitize my hands before touching
with
the
a hand
patient.
rub and all, right?
Yes,
Yeah.
I have to wear the gown properly because whenever we ask relatives to come in the ICU, we ask them to wear a patient attender gown. So that will have a barrier between the patient's relative clothes and the child. So you have to be like, these all hygiene things we tell them.
Okay.
So hygiene has to be followed. Secondly, it is about the disease prognosis. We educate them, condition. Thirdly, the financial condition. So because relatives have this mindset that okay, if you are in a government sector, this will not cost you anything. But there are things you do have to deposit, like everything. This thing changes from institution
What
to
about the
institution.
vaccine and all these things?
Yes, for immunization also, because the relatives will come, they are already coming with a patient, and at home also they will have one child.
So whether when you are health educating the parents,
Yes.
like you will tell like these are the immunization schedules.
Yes.
You need to take the immunization like that.
Yes,
So
yes.
whether they are able to follow like this or they are following.
Yes, most of the time they are following. If
Okay.
they are not,
Because it's a medicine, yeah, they could understand like this needs to be given to.
Yes.
Because most of the time I think like on some areas even now they don't know the importance of
vaccines.
vaccinations
Yes,
and all.
if they have, like if the child is not immunized or if not have not been vaccinated, then we have OPDs. So we send the child over
No,
there.
no, clearly, like these vaccines, they will prevent them,
From
their child
the-
from the infections and all these things. So whether they could able to understand like this is the key factor to give them vaccination like that.
Sir, most of the people do vaccinate their child, but if we get some that lot that okay, they have not vaccinated, then we do have to give them health education regarding that also.
So on history taking, we will take that history as well.
Yes,
like,
about
whether
immunization.
whether you have fully vaccinated your
Yes.
child like that.
No,
Okay.
not fully, like it is if the child is of 9 months, they have to get the patient.
No, up to
up to the
up to
age.
the age.
Yes,
Yeah,
up to the
that's
age.
what I mean.
Another factor is like many of the patients come with some genetic disorders. So that is because of the nutritional deficiency which the mother is suffering during the pregnancy. So we also have to educate them regarding.
It's just like hydrocephalus or something like
Yes, hydrocephalus.
that. So how common is, on your opinion, like hydrocephalus and all now
We get a lot of patients, sir.
with the hydrocephalus?
Yes, over here a lot of patients,
Okay.
and that too in the critical stage, not on the initial side.
So they won't come with the initial time. They won't come in the initial time like that, or
In initial also, but many of the patients which we get are the cases who have relapsed.
okay.
They are already having BP shunt, then again the hydrocephalus has relapsed. So it is very difficult for them because already the patient has been operated and is already having a BP shunt and still is not getting cured. So the patient part is continuously in the hospital from a longer period of time, for more than 3 months, 4 months. They are in the hospital only. So it is
Yeah,
very
the timely
difficult.
folic acid and all these things if they
Yes.
have taken in, because most of the people won't be that much aware about
Of the things. So we have to educate for that also, about immunization also, about nutritional status also, then making the hygiene, keeping many of the child comes, like relatives comes when the child has eaten something, like they are playing, the toddlers are playing and they ingest buttons and something and all. And they come with birth, they come with like some asphyxia and they have some airway obstruction. So it is, we have to educate
It's very
them.
common in toddlers, I
Yes.
think, because they are very highly active and maybe the parents couldn't able to control them or
Yes.
have a keen observation on them, like
I
just
think
because.
parents should be aware of the things about what type of toys they should give to their child. Like the toys which are having buttons and something which can be detached, they should not give those toys to the patient, because what the child will put everything in the mouth. So
That's a common tendency of
as a
the
common
child, yeah.
tendency, thumb sucking is a common tendency in children. So they will, whatever they will get, they will keep eating.
Pleasant, yeah.
So they will keep on. Once a patient came in emergency with, he has ingested around some bigger size something, I don't know, and while we were doing CPR, that thing came out from his mouth.
And the child become well.
And then in 1 or 2 days, child was okay. Child revived, and then after keeping for 1 or 2 days, patient was okay.
So I think it would be some toys part or something like that, maybe.
I think it was some snake, some toy whose stomach was filled with some round things. It was something like that. So it was detached, and that round
Yeah.
balls,
So anyway, it's part of that
the toy,
right?
And then that child took it,
Ingested, right.
ingested, and then it got airway obstruction because it was bigger in size. So, but the luck was that they immediately brought the child to the emergency and was
Also, whether you will give health education regarding deworming, like it's
Yes.
because most of the I have seen some child with the cysticercosis and all these things.
Yes.
Like it's actually
because
how
child
common
have
it is,
a habit of eating everything what they will get.
and they will play in the
Mud,
mud
soil,
and all
grass. They will eat. Sometimes we get child whose
So at least
stomach
means in between 6 months, deworming is very necessary.
with albendazole.
Yeah.
It is necessary. So we do educate child parents regarding that also.
All right. So there are so many things like
Yes, a lot of things. So for a patient party also, it is we are telling them that they are not understanding, but we have to understand their side also because it's when you will put yourself on their
and also
side.
nowadays it is very common to have child abuse and all these things. So
Yes.
so what about the health education part on that aspect to the parents?
Sir,
How common it is?
yes, sir. We have to educate the mother and the child, especially if the child is more close to parent, like father and all. We do educate them also about this difference they have to make between a normal touch and a bad touch,
That means good touch and bad
good touch and bad touch,
So need to educate this regarding to the parents as well as the child.
as well as children, because child will convey everything to their parents also. So the parents need to understand, okay, if my child is saying something, this has some meaning. So if if the parents will say like, okay, it's nothing like that, so what's the use? So,
So
parents
most
has,
of the time, the people won't recognize it is an abuse, like it's an abuse like that.
yes, most of
Right.
the time they
Most
don't.
of the time.
But if,
when we give health education to them, then they will recognize like, oh, then that child was at that day, they have said about this thing, but I have ignored.
if we have a prior information about that thing, if somebody have told me, okay, this, if somebody touches you like this, then this is a bad touch. If somebody talks to you in this manner, then this is something bad. This is not obvious. So if somebody is doing that thing with the child, something will flicker him. So he will get, okay, somebody has told me like the same thing.
Because the child remembers everything.
Everything.
That's the specialty of the child. And if the parents, if they are getting properly educated, then they will just keenly observe the child and could protect the child like that. Oh.
So apart from the child, the parents also have to be a good listener of whatever the child is saying. Child comes from the school and conveys everything, the whole day schedule to the parents. This happened, then this happened, and this happened, and somebody has told
So
me
if
this.
the parents having a listening attitude and a
Yes.
friendly attitude, then the child will keep on disclosing all the things
All the
that is
things.
happened. Otherwise,
So
the
be a
child,
good listener. Being a good listener is very good thing for parents. Because if you will think like, okay, nowadays people don't have time, so they will give a tab or mobile to their child, and they will the children will keep on playing on tab and mobile, which is a very, very bad habit, very bad practice
so whether you will
nowadays.
give health education on this
Yes,
aspect as well?
yes.
Because this could possibly harm the brain of the child.
And
right?
eyesight
Development
also.
as well.
Eyesight also.
Eyesight also, yeah.
Yes. Now every
So how common it is willingly the parents will willingly take this this opinion like we shouldn't give this much mobile exposure or this gadget exposure to the
honestly,
child.
it's very rare, sir. But still, they will understand. Okay, they understand. But it is like, okay, if when they are giving it for 30 minutes, when we are educating them and we are repeatedly telling them not to give mobile, not to make this a habit, then they will give it for 5 minutes.
Okay.
So it is like that. But
Anyway, something is better than nothing.
yeah, but people, but this is a very bad practice which nowadays child and even the parents are developing. Whenever the child is crying, they will give them mobile. They will see cartoons.
So it
on
is commonly habituated, and it is a much easier thing to do to distract
Yes.
the child. Like
Yes.
nowadays, I think.
They should
So
talk
that's
to the child. They should communicate to the child. The child will, if you're talking, if you're saying something, you are making something, expressions and all, child will automatically, okay, he will cry for 2 minutes, then he will be silent. He will listen to you. But what people have a habit nowadays, like they will give a mobile, okay, the child will say, okay, cartoon, okay, they are making faces and all, so child will be silent. So No, people have a habit of grabbing the easier things more easily. So for the mother, it is difficult, or for the father also, it is difficult to make the baby silent. Okay, so they will give a mobile. So which is not good nowadays.
But most of the parents won't accept this is like as such.
They do accept. It's like we know all the health hazards related to smoking, but we do smoke. So it is regarding just related
The
to
same
that.
scenario over here as well.
They know everything. Okay, we don't have to use phone. They will get poor eyesight. This will help in. This will like decrease his brain development and all. But still, they will give for 5 minutes. If they are giving it for 20 minutes, then maybe we will scold. We will tell them. Then they will give for 2 minutes, and then they will take. So it is like that.
So minimizing the exposure is also, it's okay.
Yes. Then.
Right, to the extent if it is unavoidable like that.
Yes.
Inevitable. So nowadays I think most of the parents, they want. So completely taking away the mobile phone, I think it is an impossible thing nowadays. I
Yes,
think.
because that has inculcated in our lifestyle, sir, so much that like
Because when the child sees like the parents are using this,
yes, all the
this
time.
you know, this highly sophisticated device like that, okay, and something is there in that, that's why the parents are using this. So the child will have a, oh, this is some precious device like that, they would think.
Yeah.
Like, yeah.
Also,
Something interesting is there in that device.
they are getting interest over there. They are able to see, okay, so many sounds, cartoons, they Tom and Jerry and everything. So that is easy for them. Okay, so it is like that.
And now I think the parents also know most of the characters in cartoon and all these things. Like when I when I have got a conversation with one of the parent, like, so he knows all the stories and all the things, the child also, and he is telling like, no, nowadays I can't even I can't even switch on the television for any news or something like that, because all the time it's cartoon. For the
Rather,
baby.
I think, sir, if apart from giving the phone, if they give them some books or some pictures who have different shapes and like
The puzzles,
colors,
right? Puzzles and all
the child
too.
will be involved in that. That will also help in cognitive development of the child. So, if you are
That
giving,
blocks and all these things,
yes,
like it would be much
give
better.
them something to color, coloring pencils and color books, and they will be more happier. But this is the demerit of our generation and our like parents, that they are just giving mobile and making the work easier.
So instead of that, these are good, options for the
Yes, for the
parents,
child.
like, and it would be beneficiary for the child as well,
Yes.
right? So on the health education part, we will give this as well, right? Most of the time. Maybe.
Yes.
Okay, so in the pediatric specialty department, apart from all these, any other thing that you need to add?
Sir, I feel that our profession is so underrated. The other thing is that our profession is very underrated. Like, if you consider any profession apart from nursing, then people will opt that profession. Nobody will opt nursing like, okay, I want to be a nurse. They will say, I want to be a doctor, I want to be an engineer, I want to be a pilot, like all that. But we are being the so crucial and important aspect in healthcare.
But now at the COVID times, everybody is appreciating nurses, and after the COVID time, there is a change actually
Yes,
on that
again,
actually.
yes. It is like that. So I feel that our profession is very underrated. We are always looked down, and so that thing has to be upgraded. So we should like everyone should recognize
Because the
how much.
major problem on that is we want to express our knowledge actually on that manner actually. We will just do our work and we will leave to our home just like that. We are not doing any research or any things like that.
Yes.
Because how many nurses will do research?
Yes.
Things. What are the new innovation on the profession and all? Because day to day, every profession, on all other profession, there will be some new innovations. But what about the field of nursing? There are so many researchers and
Yes.
there are so many systematic things are ongoing. But I think the ratio is very small
Yes,
comparable
very
to.
small
So
ratio.
that's the thing. So the generation need innovation actually, right? So and also most of the nurses, they are extremely talented in extracurricular things like that. But still, they are so. How many people will will take the talents to that much, right? Just like that. We have IAS officers, means with a background of nursing actually. We have almost 5 IPS officers with that background actually, but still nobody knows like,
Yeah.
the background is nursing actually.
Yes.
Like that. So somebody who will go on that level, so people recognize that person like that. Otherwise, within the profession also, so people won't express their knowledge like that as such. And
Many
nobody
people have this feeling that, okay, I got a government job, so I am relaxed now. Oh, I don't need to.
that's a problem of the
That's
profession.
the
Like
mindset.
every day, if you do something, something innovative, like so, I am doing like I have opened this show and all these things,
Yes.
but it is not only for the nursing, for all professionals who could come on the show, all are invited to express, okay, and to boost their profession actually in the show like that. So same, because I have a nursing background, so I will give the privileges more to the nurses like that anyway.
Oh, well, thank you so
All
much.
right. Okay, Miss Madhu, thank you for coming to the show.
Thank you, sir. Thank you so
Alright.
much. And I'll request, please do like, share, and subscribe to the channel. And please do watch the channel. Thank you so much.
Thank you.